Hey everyone, this is Derek with Orthopedic Physical Therapy Products, and I'm really excited to bring you this Next Level Content Education Series episode in collaboration with EIM Evidence in Motion. Today we've got Jen Uschold with us, who is really going to talk to us about lifestyle medicine and how learning about this topic, investing into courses under the lifestyle medicine umbrella can help you, the clinician, take your quality of patient care and career to the next level. Jen, thank you so much for joining us today.
Thank you. I am very excited to be here, Derek.
Awesome. Well, let's start just real quick with your background, John. Tell us a little bit about yourself, how you got into lifestyle medicine, how you maybe, yeah, got into that world.
Sure. I've been a physical therapist for well over 3 decades, so we'll just leave it at that. And I developed a passion for health and wellness coaching probably around 2014. And it wasn't so long after that that I really started to take a deep dive into pain science. And the framework of both pain science and health and wellness coaching is such a beautiful blend with with client care. And so it was after I completed the fellowship in pain science with EIM that they approached me about this program they were developing called lifestyle medicine. And in all honesty, I had not heard of the term lifestyle medicine. So when I looked it up, I'm like, this is a very good fit for me. And so the concepts and the main framework around pain science is really tapping into what we already know the client can excel in and helping them to take ownership of their health and their pain. Lifestyle medicine is very similar. People are just at a different place in their continuum of health. And so many of the strategies we have for pain science are quite similar to the strategies we have for lifestyle medicine. So it's a beautiful blend. And I am really passionate about helping people help themselves. That's a phrase I've used since I was a new grad in 1991, and it continues to be true with both pain science and lifestyle medicine.
Yeah, excellent. So if you were to give us just a big picture overview of what lifestyle medicine is, just a real quick kind of definition or summary, how would you describe it? What is lifestyle medicine?
Absolutely. Lifestyle medicine is using lifestyle choices and behaviors as therapeutic information. And we can use these to not only prevent, but to also treat and even reverse up to 80% of lifestyle related diseases. We are all familiar with lifestyle related diseases, diabetes, even cancers, heart disease, high blood pressure, obesity. So many of these things can be addressed through lifestyle medicine. 80% is a pretty big number, and this even includes up to 40% of cancers. It's really also important to note that we are relying on the clinician to help motivate and guide the client because if we don't have the client participating, we're not going to have success. They're not going to have success, which is the bottom line. Another really important piece is that lifestyle medicine is not anti medicine or anti surgery. It is pro appropriate use of those things. And let's use what we have easy access to first, which doesn't come with any side effects. There are 6 main elements of lifestyle medicine, and those are exercise, nutrition, social connections, stress management, avoiding risky substances, and sleep. And those things can make a powerful impact on health.
Yeah, that's wonderful. I was just going to ask you, what are the main pillars in your practice as you're delivering education or seeing lifestyle medicine being integrated into clinics? Do you find that clinics tend to focus on one, two, three of those pillars more than others? Where, how do they fall, I guess, in terms of priority, or is that even a thing?
That's such a great question. So, I'm going to answer that first from the realm of lifestyle medicine practitioners. And we have these 6 gears, and we have good research on all of the gears. And it's my opinion that we tend to stray towards nutrition far more often than the other gears. And the reality is, I tell my clients, it's not one thing that got you into this situation. It's not going to be one thing that gets you out. So we can attend to nutrition, which is fabulous and important. But if we ignore sleep and the other 4 gears, then we're not going to have quite as complete of a picture of health. So, from the perspective of physical therapists who are treating, I think I see them starting to integrate stress a little bit more as well as sleep, especially those that are going through the pain science program. But again, social connections doesn't seem that important. However, there's a very cool meta-analysis from 2010 where they looked at the 5-year mortality rate of people and their exposure to different environmental things. So those who were exposed to air pollution had a 5% greater mortality risk in the next 5 years. Those with obesity, it was 30%. One I'm forgetting, but the most astounding one is that those who experienced loneliness had a 45% greater risk of mortality. So to me, we don't want to expend one of the gears and overemphasize another. And this is where another beautiful part of both pain science and lifestyle medicine is we need to be working with the client. The client is the driver. And so if we are really gung ho on nutrition and they're not ready to address that, but they're ready to tackle sleep and getting a little more social interaction, that's where we, the clinician, need to go. We need to make it about them and their agenda rather than ours.
Yeah, that's incredible. Oftentimes just talking about how you, again, prioritize these pillars, I wanted to ask you, what you see working against them. I always hear your colleague, Adrienne Lowe, pain neuroscience expert, right, talking about the opioid epidemic, how people are still so conditioned to rely on these external fixes like drugs, right, to help them. What is the biggest thing holding people, clinicians, back from integrating these more lifestyle interventions into their patient care as opposed to, the traditional drug combined with exercise and manual therapy model?
I think there's two key restrictive factors, and the first is time. Depending on the clinic setting you're in, some therapists really are strapped for time, depending on what their model is. And the other restriction, quite honestly, is knowledge. So even whether I'm talking about a clinician or a client, I cannot expect to hold someone responsible for improving sleep hygiene or having stress management tools if they don't have any exposure to it. So, one of the key pillars in pain science is education. We know that understanding pain helps reduce pain. So, when we can help our clients and even ourselves understand the tenets of lifestyle medicine, they're going to be able to start to create those shifts. Another key component of both pain science and lifestyle medicine is the use of motivational interviewing, which at first glance might seem like it's going to take more time. However, it is a way to get laser focused with your client, and you can be more efficient with your time, opening up opportunity to address a few more lifestyle factors in each session.
Hmm. Yeah, my next question, I think you've started to answer already, which is, if a clinician takes the time and spends the money investing into learning more about lifestyle medicine, how can that help them take their career and quality of patient care to the next level?
For me, I think we as allied health professionals, we have got to take ownership for the entire human sitting in front of us. And yes, we do have our specialty in physical therapy and occupational therapy. However, it doesn't mean that we get to disregard all these other pieces. So, lifestyle medicine gives you the opportunity to truly zoom out and look at the human in front of you. And once we do a very thorough evaluation, then we can see, okay, is this falling in my expertise? And we want you to have enough information about the lifestyle medicine gears that you'll be able to make an informed decision. Is this something I can guide the client through within our time? Or do we need to consider referring out to a psychologist or possibly an exercise specialist? And so within that, we're going to create more success for our clients. And I always tell my clients the goal is for them to fire me. And so when we empower them with knowledge and strategy and tools, they are able to take ownership of their health. And that creates a win for everyone.
That's wonderful. Yeah, what this is the last question. What's the most profound story you can share with us, or one of the most profound stories, I'll say, with how you've seen this concept of, lifestyle medicine intervention, either directly with a patient you've worked with in a clinic of, brick and mortar clinicians that you've trained. Can you share a story with us how you've seen it really work? A really profound story?
Yeah, I'd love to. I'm going to share two short stories. So the first is I am the program director for the lifestyle medicine program, and one of my favorite parts of the program is in the last course. It's a virtual lab, and all of the students have to create a presentation called "Taking It to the Streets." How are you going to take all of this content that you've learned and integrate it into your current job or something new? We have had such amazing stories. People are creating programs within their hospital. People are setting up 5Ks and having tables around lifestyle medicine. We've had some international students who are going to their representatives and their political high powered people to integrate lifestyle medicine into the entire community. So it is so very exciting to see what these students are doing. And it is one of my favorite parts of the program. So now we're going to zoom into a client I had, and this guy has had a long history of back pain on and off and on and off. And when he came to me about a year ago, he was pretty much debilitated in pain. So we used a very strong pain science framework, and it just so beautifully blends into lifestyle medicine. And we would review a lot of things and we would reinforce a lot of things. And it now happens, I'd say, once every 2 or 3 visits, he'll say something, and I'm like, I'm going to put you on a billboard, because he is really putting it all together. He is understanding how alcohol makes his pain worse. He is understanding how when he chooses to eat a lot of processed food, it impacts his pain, it impacts his sleep. And so he's also done a fantastic job of really looking at what the stressors and contributing factors are in his life. So he is big picture taking it on from a thorough pain science and lifestyle medicine perspective. This is a guy who literally had to do his job from bed, doing the best he could on his computer, who now sees me every 2 weeks because he's rocking it.
Wow. That's awesome. What a story. Like from, people go to physical therapy and their injury or ailment gets better, right? But you're talking like a full lifestyle change here. I mean, that's awesome. The level of awareness that's been brought into everything you do. That's really cool.
Yeah, it's really fun too, because there's a new book called Outlive by Dr. Attia, and he and I started talking about it. And it's really fun because him and his wife are both really integrating so much of the content of that book. And that book is a dream of great content around lifestyle medicine as well.
Excellent. Good recommendation for people to check out, for sure. Um, Real quick, the offerings through EIM that you're, directly related to in terms of your instructing, or not. EIM offers a lot of different post-education courses, certifications. What exactly is available under the lifestyle medicine umbrella?
Yeah, this is great. This is the first time I can publicly tell you that we now have two certification options for lifestyle medicine. And the first one includes 5 courses. And so that's about, I think, 5 months in length. And summer will be our first cohort that we're going to start. And then we have the full advanced lifestyle medicine program, and that includes an additional 4 courses. 3 of them are faculty led. One of them is the virtual lab, and the rest are self paced. And we have topics from the lifestyle related diseases, trans theoretical model of change. Obviously, we're covering all of the gears, and we do a fair amount of motivational interviewing and practice coaching. Now, if people aren't quite ready to dip their toes into the entire program, there are several of the courses that people can actually take as standalone. The Introduction to Lifestyle Medicine course, which is 2 weeks in self-paced, that can be taken as a standalone. The nutrition course and emotional well-being as well. What I think is very unique to our program is we are definitely including the 6 week pain course that Adrian Lowe developed, because we see the integration of pain science and lifestyle medicine as so strongly connected. And the truth is, most, if not all, lifestyle related diseases include an element of pain. And another thing that's I think it's super powerful in our program is we are attending to the clinician as well. So these clinicians are not only learning skills to help their clients, they are learning how to find a better place of balance and health in their own life as well. And a lot of the students highlight their own personal changes throughout the program.
Excellent. And that all can be found at evidenceinmotion.com, right?
It can,
Okay.
yes.
Cool. So that's where we'll direct people to learn more. I'll also throw out, OPTP pretty recently published a book with a bunch of different professionals called Integrative and Lifestyle Medicine and Physical Therapy. Another great resource to check out. And
Yes.
of course, all the tools that you need for fitness and exercise, manual therapy, head over to OPTP as well. Pain neuroscience education, we work directly with Adrian Lowe. So all great resources from OPTP, and of course, EIM is where you go for all the courses that Jen just noted. But I really appreciate your time, Jen. Really interesting, and it's so wonderful to hear your stories, I think, about how lifestyle medicine has impacted you and people you work with. Is there anything else that you'd like to leave us with before we sign off here?
Mm, so I think it's Hippocrates. The best way to help people stay well is to teach them how to not need medication. I think I screwed that up a little bit, but this is the power of lifestyle medicine, to empower people to not need meds.
Hmm. That is a great way to sign off. I don't have anything else to say there. Well, thank you. Thank you so much. It was really nice to talk to you today. And I really hope we get a lot of people watching this when it comes out. But again, appreciate your time. Check out Evidence
Thank
in
you.
Motion, check out OPTP, and we'll sign off here and we'll see everyone soon.
Thank you.
Okay, thanks, Jen.